ideas and best practices. I would now like to pass the floor to distinguished Executive Director of UN Women. We are so pleased that Phumzile has joined us today, and I'm sorry for only saying the first name, but this is how you have become known. Everyone just says Phumzile, so excuse me for just using the first name, but this is something that I think is everyone is doing. So I hope it's okay. Phumzile, we're pleased to have you here with us today, and the floor is yours. Thank you.
Thank you very much. It's wonderful to see all of you. Thank you, Gabriela. Wonderful to see you, and thank you for convening us in this manner. Wonderful to see you, Maria, and thank you so much, Jeff, for your words. And I hope we are all in good health. These days, this is not a light question. It's always meant in a very, very serious way. We are supposed to be celebrating this year the 25 years of the implementation of the Beijing platform. Gabriela, all our plans, the things that we wanted to do this year, we have had to adapt, but nevertheless, we have not given up, because France and Mexico will still host the celebration of Beijing 25 under the campaign Generation Equality, and that this will take place this year. And right now, we are building up to that so that we do not lose the momentum. So we are not losing the bumper year for women. But I also want to salute women who are shouldering the health crisis, women in the front lines who are in the majority of the health workers who are risking their lives, the majority of the women who have died at work in this time of coronavirus. The majority of health workers who have died are women, 75% in Italy, for instance. And of course, when it goes to leadership, the number of women who are leading the response dwindles. And that is a concern. That is a global phenomenon. That is something that parliamentarians need to look into. Every country in the world has got women as the majority of those who are nurses. Many nurses organizations in the world today, including in my country, South Africa, I got a shock. The president of nurses is a man. The president of nurses in Zimbabwe is a man. The president of nurses in the UK is a man. The global president of the Organization of Nurses is a man. I'm like, wow. So there is really something that we need to do, starting with making sure that the representative bodies of health workers, where women are in the majority, reflect that at leadership level. But also, we've learned from previous crises, Ebola in particular, that when you exclude women from the response, you miss many important actions that you need to take. Liberia and Sierra Leone learned the hard way, and I'm glad to say that this time they were able to put women front and center of the response. Leadership of women is not just in the health sector. It's not just needed in the health sector, it is needed in every endeavor of life. Women parliamentarians, again, have to be in the forefront. We are underperforming as far as representation of women in parliaments is concerned. There is this proverbial 25% almost representation of women that seems to be what is happening in most of the countries. And 25% is a quarter of parity of the 50% that we want. So between now and 2025, we really have to work very hard to get to that 50%. We need to engage our political parties. We need to engage our electoral system, and we need to be open to special measures, be they quotas, targets, or any other way that will propel and push women forward, including younger women. We have also sought to link our response to Corona with the gaps that we had identified as critical for us to take forward in our work to respond to what has not been done in the 25 years in Beijing. It is interesting that the inequalities that have been exposed so strongly by the situation as we see it in coronavirus is very much similar with the gaps that we have seen when we're evaluating what has gone wrong, where have we not progressed in the last 25 years. So what we are doing is to match the response to Corona with the steps that we are taking to move forward to respond to the Beijing 25, as well as to intensify the implementation of SDGs. We are focusing on gender-based violence. This has been shown to be a big problem in the time of Corona. The spiking of violence against women has been a concern across the globe. The limited essential services in the countries that prioritize serving women who needed to be attended to in this time where violence erupted, the countries that made sure that women were not, if they were locked in with an abuser, they had a way to be rescued, were very few. We have been pushing very hard, and thanks to the call of the Secretary General, 145 countries responded positively, but not all of them have yet declared the services needed by women to be essential services. And I urge you, if in your country it has not been so, if your government has not declared the services of women who are affected by violence essential services, please help us to achieve this. We have called for all countries to have helplines so that women have somewhere to report. And we have also made sure that in all countries, there's a clear plan for providing shelters for women to have places to go, or to kick out the men out of the house so that the woman is able to stay in her house with her family. We are asking that governments do not take away the resources for women and for shelters, and give them to to isolation institutions that are isolating people who have the virus. We must not deprioritize the needs of women as we rightfully fight this pandemic. And of course, because we're talking about building back better, we are saying that these services must remain essential services beyond Corona, because these will always be essential. If after COVID we deprioritize, it means that we are going back to the old normal, and we want to sustain the new normal. We are calling for economic interventions for women, something that we identified as part of our Beijing 25 emphasis, and the kinds of challenges we see in the times of Corona is the packaging of the fiscal stimulus, which may in some countries not go to women. Women are a majority in the informal sector. They don't have savings, they don't have insurance, they don't have enforceable contracts. So we are urging you as parliamentarians to please unpack the fiscal packages that your countries are offering and see that there's a very clear way in which women will become beneficiaries. Because if women do not recover out of this crisis, they may never recover again, and they will just be condemned to poverty. We are asking you to pay attention also to access to technology, which, as we see, is going to be the future. The future just came too soon. The future we've been talking about, the fourth industrial revolution that we've been talking about, just came overnight. And those children, those workers who do not have access to technology are going to be left behind. So we are urging that we work with our governments, work with the private sector to push very hard for digitalization and for access to technology that is needed for children to be able to do online learning as they may need, because this virus may be with us for a long time and we don't know what's going to happen to the school system, and we don't want another lost generation of children who drop out of school, because when that happens, girls suffer in large numbers, early pregnancies, early marriage, child trafficking, etc. All of these things become intense in this game. Let me stop there. I have a long list, but I know that there's a lot of other speakers, but we must stay woke, and we must not divorce gender equality with racial inequality. These must be fought together. Thank you.
Thank you very much, Phumzile, for sharing with us how UN Women is also addressing and trying to shift in the COVID-19 pandemic situation, the focus and the effort. So thank you so much. And I'm sure you will have the chance to come back once we've had the Q&A. I'm sure that there are people already asking questions in the chat, so we'll make sure to come back. Thank you so much. And now I'm very sorry to have to, I've just been informed that Dr. Millard, who was supposed to share a presentation with us now, we've just been informed that he has been hospitalized. He is unfortunately very ill. And so, of course, he will not be joining us today. So we're very sorry to hear that and wish him well, of course. So we will jump to our last expert presenter, who is Trisha Shetty. I'm so happy that you're here with us today, Trisha. Trisha is the founder and CEO of She Says. And Trisha, please, the floor is yours.
Thank you so much, Kristen, for bringing us all together. I am in India currently, and we're still very much in lockdown. We have a 2-kilometer restriction. We can't go beyond our house for 2 kilometers. So conversations like this truly uplift my soul and make me feel like, you know, it's not all doom and gloom. Thank you to all of you, Gabriela, Phumzile, Maria, Dr. Jeffrey Sachs, for your just poignant remarks and for centering us on, you know, the important conversations we need to be pushing for. Historically, every time we've had war, the First World War, the Second World War, we have seen a progress in women's rights, from the suffragette movement to pushing for women to be equal participants at the workplace. I see a lot of leaders calling the situation we're currently in as, you know, wartime, frontline warriors, we're in wartime. Yet the narrative has been painting women as victims. We, as you know, Gabriela said, we've not acknowledged the kind of, sorry, I just got a note to tell me to speak a little slower. I do tend to speak fast, I apologize. We have not acknowledged the kind of critical groundwork that women have been doing as frontline workers. And you know, as Pascal Lamy says, this is not a failure of globalization and multilateralism, or, you know, but an over-reliance on local governance structures. Something that we kept calling for with the SDGs is to double down on multilateralism, on cooperation, and we have failed as a global community to do that. I'm a huge fan of the game Pin the Tail of the Donkey. And what I mean by that is calling out, you know, bad practices. And what we're seeing right now is donkey leadership. In India, we have tested less than 1% of our entire population, yet we are, you know, we have alarming increase of cases, as Dr. Sachs highlighted. We're currently third after America and Brazil. And in terms of policy and why we're lacking representation and the very real outcomes it has in people's lives, you know, Madam Phumzile mentioned essential services. In the beginning, when the government declared what were the list of essential services, sanitary napkin manufacturers were not included in that list. It's only after people raised a hue and cry saying, we have a limited supply of sanitary napkins, we need to ensure the manufacturers are included in the list of essential services, did they then see fit to include that? So it again goes to show you, you know, the real repercussions of not having representation and how it's affecting policy. Even when you talk about the PPE kits, you know, NHS has over 75% women who are, serving in NHS. PPE kits globally are designed to fit a male body. they're not fitting female, they've not been designed to fit the female body. And that's caused huge issues for women, from their masks not fitting them to their, the eye gloves not fitting them to the bodysuits not fitting them. It's being designed for a man who's 6'2". So we're seeing such real concerns that are not being highlighted because it doesn't sound sexy, right? PPE kits are not being designed for women. We're not hearing these conversations being put to the forefront. You talk about domestic violence cases. India has seen one of the largest increase in domestic violence cases. We did have good advocacy on that front. We did have a crisis number that was launched. We did have actors from the film industry come forward and say domestic violence will not be tolerated. But what you see is a complete lack of resilient infrastructure, again, going back to the SDGs, because even if a survivor of domestic violence calls up to ask for help, where is she supposed to go? There are no safe homes. Safe homes aren't taking women in. At best, you can hope that the police personnel will call up the husband and say, hey, we've received a case, you may want to stop, because courts are not entertaining cases. They're not making any more arrests right now. So we're seeing a complete lapse in infrastructure. And as we know, in India, 1 out of every 3 women will be subject to intimate partner violence. Talking about the workplace and economic empowerment, we have data, we've had data we've cited for a very long time as to how when women are economically empowered, when they make money, they invest up to 90% back into the economy. And a lot of it, when they invest the money, it goes back to education, to good health, to infrastructure, services that we very much need to double down on in the post-COVID world. Yet what we're seeing is now new norms being passed in the workplace. A state in India has now laxed workplace norms, where there is no more need to have creches in factories. There is no need to have sanitation facilities, no need to have toilets. They're extending hours of unpaid work. They're extending it well beyond 7 p.m. to 9 p.m. to extend till late hours of the morning, which brings to highlight again, how is a woman supposed to account for transportation from workplace back home? And again, says that we're really pushing the progress we have made to ensure women are equal participants at the workplace back by decades, in the interest of capitalism, and we must reboost the economy, but we're completely leaving behind women. Another thing I want to highlight is education, as we spoke about. In India, as with a lot of countries in the global south, and when I say global south, I mean economically, not geographically, because we don't really talk about Australia when we refer to global south in terms of economic crisis. So a lot of children would have access to quality nutrition in the educational institutes. With all the educational institutes shut down, we're seeing an increase now again in female malnutrition, which is not being addressed. And finally, what I want to get to is the suspension of human rights. So not only have we seen a suspension of physical activity, of economic activity in countries like India, Philippines, we're also seeing a suspension of human rights. As a lot of you may know, there were protests happening in India against our Citizenship Amendment Act, which a lot of us saw as discriminatory towards our Muslim brethren. The international community also spoke out against this. And all those who were participating in these peaceful protests have now been targeted during COVID lockdown and are being jailed, and political prisoners are not being afforded any sort of access to their rights. We had a pregnant girl, a 27-year-old pregnant student activist who was kept in solitary confinement and was not given bail for months. And only after a lot of pressure was she finally granted bail. So this is something I really want, people, this group specifically, because of the power you all hold, to highlight that we are seeing a complete suspension of human rights during COVID. There is further pushback happening on CSOs, on civil society, that we don't have the time, and the kind of pushback that we're seeing, it will take decades of work to come back to fighting for human rights that we have fought for so long. And I'll conclude with just one thing. I said this when I was with Fumzile in Davos at the Global Goals dinner. And I spoke about how, the times that we're living in calls for good leadership. But the good news is political will and politicians are renewable resources. And that's what I want to stress on more than ever, that, it's not time anymore for us to ask for female representation, for young people to be holding office politely, nicely, with patience, because the times we're in don't call for that. And the people, the gender that we are representing or trying to, elevate here is too much in distress for us to be polite and, be at the mercy of the old guards anymore to do better. So that's what I will, leave this cohort with, and I will give it back to you, Kristen.
Thank you so much, Trisha, and thank you for sharing some of the more like specific examples of what this means for women.